Welcome to my father's show, ColdLaser.tv. Go North Mac Panthers! Woo!
Hi there, thank you for joining me today. My name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois, and I'd like to thank you for joining me on this episode of ColdLaser TV. So today we're going to talk about a topic, and I got this topic via an email recently, and the question is, a very good question by the way, the question is, I heard that someone could get burned by laser therapy. Is that true? Well, no and yes. So first of all, we have to differentiate what is a cold laser therapy treatment and what is a hot laser therapy treatment. So in my office, Austin Family Chiropractic in Verdon, Illinois, I use actually 7 main laser devices. I also have a few minor laser devices as well, but I just don't use those as often when patients come in. Now, I've been using lasers for 7 years, over 7 years, 7.5 years I guess, in my practice at this time. I have performed several thousands of laser treatments on well over 1,000 patients, and I have not burned anyone yet. But I'm only using cold laser therapy devices. I'm not using any hot laser therapy devices. So the cutoff line for what is a cold laser therapy device and what is a hot laser therapy device is actually something that puts out a power that is over 500 milliwatts, or over half of a watt. So for example, my strongest device, my strongest cold laser therapy device is just below that cutoff line, and that is 500 milliwatts. It's what's called a class 3B laser. Now, we have class 1 lasers, class 1M lasers, class 3 lasers, and class 3B lasers. We also, there is a category called class 2 lasers, but I honestly don't own any of those. So I own several class 1s, several class 1Ms, several class 3s, and some class 3Bs as well. So those are all considered cold laser therapy devices. And from my experience, it is impossible to burn a patient using a cold laser therapy device. Now, if we get into the hot lasers, it is definitely possible to burn someone with those. And that is why, as a practitioner, I do not use hot laser therapy in my practice. That's one of the reasons that as a practitioner, I do not use hot laser therapy in my practice. Quite honestly, it's just a risk and reward thing. I can get the same results. It might take me a little more time with the cold laser therapies, but I do not have to risk burning a patient. So it is not worth it for me. It's not worth it to have a patient come in and have to worry about burning them. So that is one of the reasons I do not use, and I will never use, a hot laser therapy device. As Austin Powers would say, it's not my bag, baby. So that's why you will not find me using hot laser therapy devices. Now, from what I understand, as far as all the data compiled, there have only been 2 people in the history of using laser therapy in the U.S. that have ever been burned by a laser therapy treatment. They were both hot lasers. So when we say hot lasers, we mean a class 4 laser. Class 4 lasers can burn people if we do not move them quick enough. Now, for example, this is one of my minor class 3 laser therapy devices. And I'll just demonstrate with this. Some of my patients own this device that they use at home. But for example, if I want to hang out on an area for even 10, 15, 20 minutes or a half hour at a time, I can do that with a cold laser therapy device. I don't need to move it around. It's not going to burn tissue because it does not generate enough of a thermal effect to burn tissue. But if this was a class 4 device, ladies and gentlemen, I would have to move it around, and some of the manufacturers, they won't even allow you to touch the skin with it. Some of them have you holding it 8 inches out here above the skin, which is, I alluded to in a previous video, is not proper cold laser therapy technique. But the bottom line is, if this was a hot laser and I kept it in the same spot for too long, it would burn the patient. And to me, like I said, that is just not worth the risk. That is not happening on my watch. It's not happening in my clinic. So my patients do not have to worry about being burned during a laser therapy treatment. But if a hot laser therapy practitioner does their hot laser therapy and they know what they're doing, there's probably very little chance of you getting burned. But like I said, there still is that chance, and there is the risk that is not there with cold laser therapy. So that is the answer to that question. It is possible to get burned with a hot laser, although that doesn't happen very often. It's only happened twice that I know of as far as the history of laser therapy in the US. But I also want to get to the point that if you've ever been to my coldlaserconsulting.com homepage on that website, you will read that I talk about there's a fair amount of BS that's tossed around in the laser therapy industry. And mainly that is to just get you to, if you're a doctor or a healthcare provider or an athletic trainer, they want to get you to buy one company's lasers and say the heck with the rest of them. So some of these people will lie. So if someone only sells class 1 lasers, they will lie and tell you that, oh, doctor, you never want to get a class 3 because that could burn someone. But I'm here to tell you that's not true. Now, if they say, oh, you never want to get class 4, you could burn someone, then obviously that is a true statement. So you just want to be careful when you're wading through the BS to get to the facts in cold laser therapy. And that's one of the reasons that I deliver to you the coldlaser.tv online video blog. So that answers the question. Yes, you could be burned by a class 4 laser, although it happens very rarely, a hot laser, but it is impossible to get burned by a class 1, 1M, 3, 3B, or 2 laser device. Now, I will warn you one last thing, that many hot laser therapy practitioners will never use the word hot in their marketing. They will only use the word class 4. So they're never going to, it's never going to have on their shingle hot laser therapy. Whereas a cold laser therapy practitioner, it's going to say cold laser therapy, or the synonym for that is low level laser therapy. So if you're like me and you only want to subject yourself to getting cold laser therapy because you don't want to risk at all getting burned, you're going to want to find a cold laser therapy practitioner or a low-level laser therapy practitioner, which are one and the same thing. So you may be a little wary of the class 4 practitioner. So that's all I'm saying there. But like I said earlier, there's a lot of class 4 practitioners I know of that have never burned anyone, because they've been using them a long time and they know what they're doing. So that's my take on it. I hope that answers your question, and I look forward to having you join me in future episodes of Cold Laser TV as we discuss other topics about one of my passions, cold laser therapy. Thank you and have a terrific day.